Don't forget, I'm your daughter. I grew up with all of the things that you're discussing. I definitely know all of the fear that you're describing, but I had to overcome the fear, which is an emotion, with knowledge.
That was just a glimpse of a nearly 30-minute fire chat conversation about the COVID-19 vaccine. It's part of a new approach to address vaccine hesitancy and benefits, providing critical supports to and by First Nations, Métis, and Inuit communities.
Elderly people, and nobody really pays attention to them. So I'm sorry about that.
Yeah, it's true. You're absolutely right, Mom. And that is a big problem with today's society.
A heartwarming exchange during a fireside chat.
A lot of people are sitting in the dark. They don't know what to do. They don't know where to turn. So I'm just thanking you for the fact that you have included me and you have listened to me.
It's these voices that are elevated in part by Madoking Mishkiki. Sharing Medicine, a virtual hub created to address barriers, provide supports and resources to Indigenous communities.
This is not a decision that can be imposed on anyone. This is actually all about providing the resources which are accessible, culturally relevant, meaningful from your perspective as an Anishinaabe or Haudenosaunee or Métis or Inuit person, that then you can make an informed choice for yourself.
Bridging both traditional knowledge, culture, and healing practices along with scientific information to empower those to make a decision about the vaccine, while also acknowledging racism, trauma, and mistrust.
When we're looking at the specific experiences of Black and Indigenous peoples in the healthcare system, vaccine hesitancy is an issue with the healthcare system, which has a history of and ongoing practices of excluding them, being racist, and of mistreating Indigenous and Black peoples and many other peoples who are from structurally marginalized groups.
In addition to Indigenous doctors and healthcare providers, the voices of trusted community members are central. Knowledge keepers, traditional practitioners, and elders.
There's still being some pushback present day in regards to respecting knowledge translation processes and governance practices in terms of who we see as leaders and who sits at the table and who has a voice.
The virtual hub is a partnership between the Centre for Wise Practices in Indigenous Health at Toronto's Women's College Hospital, a number of Indigenous health community organizations, and groups that have formed the Circle of Community Engagement and Review.
Everything that we are creating is to be community centered and undergoes knowledge translation process so that it's engaging and impactful to reach as many of our Indigenous community members, both urban and homeland related areas as much as possible.
Indigenous communities are one of the priority groups that have been identified for vaccines by the government. And those behind this initiative say it's vital to provide as much information now so people are informed as much as possible when it's time to get a shot at vaccine centers.
There won't be time to have that engagement around what are the risks, what are the benefits, how did this feel when my auntie got the vaccine, how, what are the concerns that I have?
The materials will also be translated to Indigenous languages. To find a link to the virtual hub, you can head to our website, citynews.ca/extras. And by the way, these resources can be accessed by anyone who might need them. In Toronto, I'm Faiza Amin for City News.